Are you like most professionals who haven't received training to meet the mental health needs of older adults? Well, this podcast is for you. Welcome to the Psychology of Aging podcast. I'm Dr. Regina Kepp. I'm a geropsychologist and founder of the Center for Mental Health and Aging. I created this podcast to give you tools and insights to meet the mental health needs of older adults. This is after 20 years of working with older adults in some of the largest healthcare systems in the United States. Each week, I share evidence-based tools that you can use with your clients starting today. And if you find the resources here helpful, check out our online continuing education courses at mentalhealthandaging.com. All right, let's jump into today's episode. We know in the past few years with the COVID-19 pandemic, there have been unprecedented levels of stress in the United States. We also know that stress directly impacts mental and physical health. And one of those physical health concerns being heart disease. According to the American Heart Association, 50%, that's 50% of Americans are living with high blood pressure. With the combination of high levels of stress and high percentages of people living with high blood pressure, it is critical that we have tools to help people living with high blood pressure, heart disease, and all sorts of cardiovascular health needs. So today I'm delighted to bring you a 60-minute continuing education episode on biofeedback therapy for cardiovascular health with Dr. Maggie Johnson. Before I tell you about today's guest, Dr. Maggie Johnson, I want to just exercise a word of caution here. In this episode, Dr. Johnson walks us through an exercise. It's kind of a mindfulness exercise, but I would encourage you to only participate in this exercise if you are in a place that is safe and secure and where you're not operating a vehicle or heavy machinery or anything that could injure somebody if you're not careful, including yourself. So just use caution when engaging in the exercise. If you aren't able to do the exercise because you're driving or whatever else, come back to the episode and do it. It's a really wonderful experience. All right, now let me tell you about today's guest, Dr. Maggie Johnson. Dr. Maggie Johnson is a clinical psychologist at the Western North Carolina VA healthcare system, where she provides behavioral health interventions to veterans coping with chronic health conditions, chronic pain, depression, PTSD, and anxiety disorders. She specializes in health psychology and complementary and alternative medicine. Previously, at the Atlanta VA Medical Center, she worked in a health psychology clinic and participated as a health coach in their home-based cardiac rehabilitation program, where she assisted veterans in managing their risk factors for heart disease. She also helped them make lifestyle changes and manage their stress. She's presented at regional and national conferences on topics of health psychology and biofeedback, and is certified in HeartMath biofeedback, and is very passionate about mind-body interventions. I'm delighted for you to be joining us today, Dr. Johnson, and to share about biofeedback and cardiovascular health. So thank you so much for being here.
Yeah, absolutely. My pleasure.
Can you kind of start us off by sharing about how chronic stress increases the risk of cardiovascular events? What's the relationship there?
Yeah, absolutely. I've always been interested in the link between stress and heart disease. And, there's a lot of research on the negative effects of stress on heart disease, and not just heart disease, many other diseases like, cancer and GI issues and dementia and Alzheimer's disease. So, chronic stress increases inflammation in the body. And with chronic stress comes, elevated levels of stress hormones like cortisol, and elevated blood pressure and elevated blood sugars, which can contribute to damage, to the artery walls and plaque buildup and eventually development of heart disease over time. So good stress management is really critical for a healthy heart. And also, emotions affect the heart. So we know that emotions are not just in the head. They're experienced throughout the body, often without conscious awareness, and, different emotions affect the heart in different ways. So, like, for example, depression can trigger an increased heart rate in cardiac patients. People with depression may also have more sticky blood platelets, which can lead to things like blood clots, and also social isolation and feelings of loneliness. People with heart disease who are more, socially isolated have a greater chance of dying than those with a stronger support system. So we know a lot about, the negative emotions and the heart. And, what about the positive emotions? So, positive emotions are cardioprotective. Feelings of love and care have been found to lower blood pressure and heart rate. Happy individuals have a lower chance of heart attack. And, all of this was really, fascinating research to me. I'm always looking for ways, to support my patients in reducing their stress and, living heart healthy lives. And, especially right now, I think it's so important, to learn ways to calm the nervous system. There's so much stress and anxiety in our world, and we're really living in this time where everyone's nervous system is hijacked. And so we need to do some, self-reflection and, learn new and effective ways of handling the stress.
Yeah, I really, you're saying that, of course, negative emotions can impact the heart negatively, and positive experiences and emotions have a positive effect on overall health, including heart function. I remember a while ago reading a study. I did a presentation a few years ago at a keynote actually at the Atlanta VA for women veterans. And it was on creating a community of care and a care culture. And there's I thought I read some research on what it does to the heart when we actually give a gift. And then it actually, I think one of these studies that I cited in that talk was that it lowered blood pressure or something. Do you know, is that consistent with what you found?
Yes, absolutely. So feelings of appreciation and gratitude, gratitude, those positive emotions have, a cardioprotective mechanism that actually lowers blood pressure. And so when we do those practices like creating gratitude lists, that's something that, I really encourage my patients to do. Come up with, 10 things that you're grateful for. Just make a list, 10 things that you're grateful for. And they can be small things. They don't have to be, major things. It can be like, okay, today I was able to get my garage door open. Woo!
Right.
So, small things, little things like that. Creating a gratitude list is a really powerful activity to do.
Yeah, we're at a stressful time in our family life. And I find myself when I take walks with my husband outside and it's a beautiful day, just thinking we're so lucky to be going on a walk in the middle of the day, when my former life, I wouldn't be able to do this. Just having a little bit of gratitude for a simple thing helps a lot with my own stress lately.
When I have my patients do a gratitude list, and then I have them check in, how do you feel before writing the gratitude list? And then after you do your gratitude list, how do you feel? And usually the patients, they feel better from creating a list. They feel better. So it's like an immediate shift.
Mm-hmm. So that's one element of coping with stress that can have benefits for our overall health, including our heart health. And then you're here today to talk specifically about biofeedback, and biofeedback as a stress management tool in preventing cardiovascular disease, or helping with cardiovascular disease when people have it. Can you start by sharing what biofeedback actually is?
Yes. So biofeedback is a technique that you can use to gain greater awareness of your body's own physiology. So it allows you to have a greater understanding of your own body and how things are interacting, and to receive feedback about your own body. So your body is it's constantly sending you messages, through your breath, through your heartbeat, through your skin temperature, muscle tension, and they're usually subtle and go undetected until they intensify and really grab your attention. Things like a pain or a migraine headache or a stomach ache or an anxiety attack. Like, whoa, okay, I noticed you now. And so biofeedback is a way to understand and recognize your body's messages so that you can make changes then to better self-regulate. So with biofeedback, you can measure basic physiological functions like heart rate and blood pressure and muscle tension, body temperature, respiration rate. And then using technology, you can receive information or feedback about the body, which then helps you make subtle changes in your body to then improve your well-being and your performance. So you're noticing, what happens to your heart rate when you change your breathing. What happens to your muscles when you learn to relax or, release certain muscle groups. What happens to your skin temperature when you visualize positive mental images. So the goal is really to be able to better self-regulate. So self-regulation is key. And I also think, too, to understand biofeedback, I think it's also helpful to have an understanding of the nervous system. So, our autonomic nervous system, it regulates our stress response. The sympathetic and the parasympathetic branches of the nervous system, they're like the gas pedals and the brakes. So our sympathetic is responsible for speeding everything up, increasing heart rate and blood pressure and breathing rate. It triggers the body's fight or flight response. And that provides us with that burst of energy to respond to perceived threats of danger. And then our parasympathetic nervous system is a complementary system that slows everything down. It lowers blood pressure, lowers heart rate and breathing rate, and essentially brings us back to homeostasis. And so with biofeedback, we can learn to monitor our body's signals as they move through, activation of the sympathetic and the parasympathetic nervous system. So just like we can go to the gym, right, to strengthen our muscles, we can learn to strengthen our autonomic nervous system with biofeedback training. So we can learn ways to, better self-regulate and to really just to meet the challenges of everyday life.
When a person is using biofeedback, what equipment is used? Are people hooked up to heart monitors and EEGs, or how does it actually work? What does it look like?
Yeah, so there's lots of different tools, lots of different biofeedback machines and different methods. They might be connected up to equipment that's measuring their heart rate or their heart rate variability, which I'll talk about a little bit later. There'll be pulse sensors that pick up sensors, from their ear or from their fingertips. They might use EEG. They might connect them, use little sensors connected to their brain to look at different brain waves. That's actually called neurofeedback. They might have a mechanism that connects to their breathing, like a little mechanism around their stomach that connects to measure their breathing and their respiration rate. There's lots of different ways to measure different physiological responses.
Before we get into the cardiovascular health, what other sorts of conditions is biofeedback commonly used for or shown effective with?
Yeah, so there are there's a number of chronic conditions that biofeedback has been proven efficacious for. Things like stress and anxiety, chronic pain is a big one, fibromyalgia, high blood pressure, headaches, asthma, ADHD, PTSD, depression, just to name a few.
Wow. Okay. So a lot of groups are doing this from medical to mental health.
Mm-hmm.
That's great.
Yeah.
Okay. So a person is using a biofeedback machine, and is it always done with a machine, or can people do it just by like looking at their own heart rate?
Yeah. So in some cases, so you can actually do biofeedback by, like, for example, temperature biofeedback. You can actually go on Amazon and get yourself a little thermometer, and you can use that to measure your temperature. You can actually do that at home. So it doesn't necessarily always you don't have to always use equipment. There's actually a lot of apps now that are doing kind of like a biofeedback, like using the like camera on your phone. It can pick up different sensors like heart rate and different measures to look at, different biological markers. So that's really neat. And I think we're going to be seeing a lot more of that moving into the future with, the advancement of technology these days. And and there are also devices that and I'll talk a little bit more about this later with HeartMath, which is a type of biofeedback that I use. And there is a personal handheld device, it's called an M-Wave, that the participants would take home to measure heart rate variability. And so it's like a little personal handheld device that they would put their finger over, and it would pick up heart rate variability, and it would be able to measure kind of your biological response to stress in real time at home.
So biofeedback is used for lots of conditions like stress, chronic pain, high blood pressure, asthma, ADHD, PTSD, just to name a few. People can use their own devices that they buy on Amazon, or even just doing a temperature check. And then they can use more, technical assisted devices with a professional. So let's move into like biofeedback for cardiovascular health and cardiovascular disease. So how does biofeedback actually help with cardiovascular disease?
Yeah. So we're seeing biofeedback being offered, more often as part of stress management training in, cardiac rehab programs. And, research has shown that biofeedback training, helps with treating high blood pressure, which is a major risk factor for cardiovascular disease. And according to the American Heart Association, close to half of all adults in the United States, yes, I said half, suffer from high blood pressure. And, with our aging population and increase in life expectancy, this number is just, expected to continue to go up. And, risk factors for high blood pressure include modifiable factors like obesity and dietary factors, smoking, inactivity, stress, negative mood states like anger and hostility, and non-modifiable factors, things like genetics and age and race, with African Americans being at higher risk, and gender, with men being more at risk. Actually, until women reach menopause, then their rate of high blood pressure goes up, which may be due to the decline in estrogen. So basically, I say all this to highlight the importance of having a comprehensive approach for treating high blood pressure that targets both lifestyle changes, medication management, and good stress management. And oftentimes, treating high blood pressure is something that we're often doing in cardiac rehab, and is a big part of cardiac rehab programs. And studies have shown that heart rate variability biofeedback helps bring balance to the nervous system and lowers blood pressure. And I'll give you a little bit of background on HRV, or heart rate variability background biofeedback, which is also the type of biofeedback that we offered in our cardiac rehab program. So you might be thinking, okay, what's heart rate variability or HRV? So HRV, or heart rate variability, is the beat-to-beat variations between heartbeats. And this is different from your heart rate, which is the number of times your heart beats per minute. So HRV measures the time between each heartbeat. So the heart is a muscle, and it's constantly pumping blood throughout the body, and it's continuously shifting between an acceleration and deacceleration in a kind of like tug of war with the autonomic nervous system, which then creates our heart rhythms. And so our heart rate is always changing depending on the activity or your emotions, and variability is your heartbeat's ability to shift and change. So a healthy heart is a responsive heart. And HRV provides information about the interactions between the sympathetic and the parasympathetic nervous systems. Remember those gas pedals and brakes, and our body's ability to regulate those systems. So HRV is a good measure of performance of the cardiovascular system and how well your body can handle stress. And it's not something that you can feel or observe without some kind of technological device. And so that's what we're measuring with biofeedback. And another interesting thing about HRV is that HRV naturally decreases with age. And we also know that lowered HRV is associated with an overactivation of the nervous system. And it's a predictor of poor health outcomes, like increased risk of high blood pressure. And studies from the American Heart Association showed that low HRV is associated with higher risk of death in patients with heart disease, and patients have an increased risk of death following a heart attack if their HRV was low compared to individuals with a higher HRV. So then conversely, higher HRV is associated with greater resilience and lower stress. So when there's more balance in the autonomic nervous system, HRV tends to be higher. So our goal in HRV biofeedback training is to raise HRV. And I've gotten questions from patients, asking me, well, don't you want to see a low heart rate variability? But no, you actually want to see higher. So higher HRV means, more resilience, less stress, more adaptability, greater ability to shift and change. And, our body was built for being activated and, for being able to recover. This is a good thing. From an evolutionary perspective, we were wired to be able to spot danger in our environment, and our nervous system would warn us of that danger. Like if a saber-toothed tiger was lurking in the background, and our ancient ancestors, if a tiger was in the background, then they would kick in a fight or flight response to either run away or fight so that they didn't get eaten by that tiger for lunch. And those that didn't have this built-in alarm system, well, they got eaten and their genes didn't get passed on, and we're not related to those folks. We are very much wired for survival. But in modern day life, there's really only a few situations where we need that true fight or flight activation. And where it becomes a problem is when we get stuck in that activation state, like chronic stress and negative mood states, like anxiety and depression and frustration and anger, which have all been correlated with a decrease in heart rate variability. And so HRV training is helping the client, get back to their baseline and improving emotional well-being and overall performance.
So interesting. So when you're doing biofeedback, you're attending to HRV and trying to increase HRV to create a higher HRV level? Is that right?
Yes.
And so you're monitoring HRV, which is the length of time between beats.
The variation between each heartbeat. Yeah, exactly.
The variation between each heartbeat. Okay. So give an example. So between beats A and B could be a couple of seconds. Between beats B and C could be more or less. Between beats C and D could be less or more.
Yeah, exactly. It's not like a steady number, right? It's constantly changing depending on what we're doing or, activity we're doing or the emotions that we're feeling. It's constantly changing.
Okay. And when people come to see you for biofeedback for cardiovascular health, their HRV may be low, and your goal is to increase HRV.
Right.
Okay. And was it increasing the variability within the HRV, or it just increasing the HRV overall, like per minute? I'm a little bit confused on that. Maybe it doesn't matter.
Yeah. So yeah, and it's interesting. So in HeartMath, which is the type of biofeedback intervention that we offered in our clinic, they're actually looking at a something that's called coherence. And I can talk about that too a little bit more when I talk about what the patient experiences when they come in for biofeedback treatment. But coherence is a measure that we're looking at that is measured by heart rate variability and can actually be visualized on a graph. And so we're actually looking at like graph outputs.
Oh, cool.
In session.
Okay, so what does a person? So say a person is like, yes, sign me up for biofeedback for cardiovascular health with Dr. Johnson. So what would they expect? Like, how does it all work? Yeah.
So a client is coming in for biofeedback for the first time. So during the first session, we would talk about, presenting issues. What's the reason this person is coming in to see me? What are their goals for treatment? What barriers are getting in the way of them, achieving their goals? We assess, previous coping strategies, what's worked for them, what hasn't worked. We do a clinical intake with psychosocial history, rule out any serious mental health conditions that might interfere with their progress in treatment. And then after we've done, an overall intake session, so just to back up a little bit, so like I said, so we use HeartMath in our clinic, which is a HRV biofeedback training program. And one thing that we emphasize in this program is that it's not relaxation training. So the primary objective is to help the client learn tools to better self-regulate and to sustain better composure and balance as they face, everyday challenges. So, I'll say to them things like, you've likely experienced a time when you felt like you didn't have much energy. And, you may have even said phrases like, I'm running low on fumes, or I'm drained. And I have them, think about a time that they felt this way and how it affected them and those around them. So, when your energy is low, it can be difficult to think clearly and perform tasks and to bounce back, which are all good indications that your resilience is low. And in HeartMath, we use the analogy of an inner battery. So when you have a high level of resilience or a fully charged battery, you have greater capacity to remain calm, to think more clearly, and to be more in control of your emotions so that you don't overreact. And when your inner battery is low, like when your cell phone battery is low, there isn't energy to draw from when you need it. And it's difficult to be your best during stressful or challenging situations, or really even during everyday situations. So the key is learning how you spend and renew your energy. And we spend time, getting familiar with their particular energy draining and energy gaining situations. And then I do a biofeedback assessment, and I get baseline measures, and I record heart rhythms and heart rate variability, where I can actually get, real-time feedback about the person's physiology. And then I teach the biofeedback practices. And, in HeartMath, we're also looking at a measure called coherence. So coherence it's a natural state and can occur, spontaneously when we're doing something that we enjoy or we're doing something where we feel positive. There's times when we feel like things are just like in sync and flowing with ease. When we're in this state, things can come up that would usually get under our skin, but they seem to just kind of roll off our backs. So that's what coherence is all about. When the mind, when the heart, when the emotions and the body, when they're all, working together in sync. And it's not the same thing as being in a relaxed state, but rather what, athletes call like being in the zone, right? Mm-hmm. And during that time is when we feel inspired or have a deep sense of connectedness, not just to ourselves, but to others and to even life itself. And that's what coherence is. And coherence is measured by heart rate variability and can be visualized as a person's heart rhythm becoming more synchronized and ordered on a graph. So imagine like smooth and harmonious waves on a graph. So a smoother heart rhythm pattern would indicate, more balance within the nervous system and a more balanced emotional state. And so positive emotions like feelings of love and appreciation, they generate a smoother heart rhythm. And irregular or jagged heart rhythm patterns indicate less synchronized nervous system and a more stressed emotional state. So like negative emotions like anger or anxiety cause the heart rhythm to become more chaotic. And so HeartMath analyzes the smoothness or the jaggedness of the heart rhythm and then assigns it a score. And as clients improve their score, they increase their level of coherence. So using the HeartMath training program, we can objectively monitor heart rhythm patterns and actually confirm when one is in a coherent state. And with practice of tools, the client can learn, how to shift into coherence, with the goal that eventually they'll be able to use those tools in real life during challenging situations that would have, previously caused them stress and drained their energy.
Okay. A minute ago, you said, as part of your clinical assessment and your biofeedback assessment, you assess for contraindications for biofeedback, like some maybe severe mental health conditions. What are contraindications for biofeedback?
Yeah. So, and what I meant by that, so in terms of the things that we were assessing for that would be contraindications are things like, severe mental illness that had not been treated yet. Like we would want to refer them to see a mental health specialist or talk to a psychiatrist, about or get them connected to mental health treatment, before starting the biofeedback, or if the patient had suicidality, we would want to treat that before doing the biofeedback treatment. There really are very few, contraindications to doing biofeedback. It's a very safe intervention, very safe, very effective, evidence-based intervention.
Mm-hmm. The other thing I was wondering is, this is even before the assessment, but as you were talking, I was thinking after I had my second child, I was an older pregnancy. And so there's higher risk for complications and higher risk for postpartum preeclampsia, which is like high blood pressure after having a baby. And I had blood pressure spikes after I had a baby. It went away. I'm fine. But I remember like when my blood pressure was super high, I had to be readmitted into the hospital. So I was discharged home. I started to have high blood pressure spikes, and that would just stay persistent. I remember I went to the pharmacy up the street from my house because I didn't have a blood pressure cuff at home, but I was like super agitated. I was I remember it wasn't, I didn't have shortness of breath, but I was just like, it just felt so chemically like I wasn't right. And so I went up the street to the pharmacist. I got a blood pressure check. It was super high. The pharmacist was like, well, let me check myself, and I had just had a baby. I had a C-section, so there was more to the medical picture. Um, so the pharmacist checked herself and it was normal because she thought, well, maybe the cuff is broken. And then she got another cuff, like off the shelf, brand new one, and tested it on her first. And she had a normal reading, like 120/80. And then we tested mine and it was super high, like super, super high. And so then I bought a blood pressure monitor. I went home and called the doctor and I had to go back in. But I remember the experience of feeling like super agitated, and like that was I was on edge, I was agitated, and I wondered if that was due to the like elevated blood pressure itself, that I was having all these negative feelings. When my blood pressure was regulated, I didn't have as much of that. Like, do you notice there's a physiological, like how much, I guess the question is, how much does blood pressure actually influence emotion and sort of emotional state?
Mm-hmm. That's a really good question. I would imagine too that, postpartum, you were just probably going through so much stress. It's such a stressful time, and you're probably, you were probably under a lot of stress. And then on top of it, having high blood pressure and then worrying about, getting your blood pressure down was probably a very stressful time in general. But yeah, no, that's an interesting question. Well, being in that like constant, like chronic, like fight or flight, stress, being in that constant, fight or flight, right, increasing your blood pressure, and then feeling the physiological effects of having high blood pressure, right, then increases more of that fight or flight. So it's like you're kind of stuck in this like cycle of chronic stress. So that is a really interesting question. I don't know the answer to that, but like I said, I would imagine you're kind of stuck in this chronic cycle of stress.
Yeah. And then the blood pressure, needed to get regulated. So, and monitored. Yeah. That it was so interesting. Because after my first child, I didn't have any of that. And I was I was an older pregnancy. There's higher risk for complications like that. But I just remember that experience helped me to develop so much more empathy for people I know who are living with high blood pressure. And just, it felt very physiological. It didn't feel like any type of stress I had had before. It felt like I could feel just energy rising. It was just so intense. And I just, I don't love that I had that experience, but I appreciate that I now have more compassion and empathy for people who are living with high blood pressure and just this intensity. And then that stress loop or that stress cycle, it kind of feeds on the, my parasympathetic system was not functioning well enough to manage all of that. But it just helped me build so much more empathy.
Do you want to try an exercise? I'll teach you an exercise called heart-focused breathing that's used to help clients take the charge out of a stress reaction and to shift into a more coherent state.
Yes, I would love that.
Wonderful. Okay. Yeah, and I also encourage listeners to try this too. So let's start. So adjust yourself if you need to. Finding a comfortable, seated position. If you need to readjust yourself, it can be helpful to have, your feet flat on the floor if you're sitting in a chair, your hands resting in your lap. And so the first step is focusing your attention on the area of your heart. So just gently focusing on your heart area. And beginning to breathe deeply in the center of your chest, right in the area of your heart. And if you like, you can put your hand over your heart if that helps you connect. And continuing to focus on your heart area, imagining that your breath is flowing in and out your heart area with ease. Breathing slowly and gently in through your heart, and maybe a count of 5 or 6, and breathing slowly and easily out through your heart to another count of 5 or 6. And continuing to breathe this way until your breathing feels smooth and balanced, but not forced. And as you continue to breathe with ease for a few moments, finding a natural inner rhythm that feels good for you. Okay. What was that like for you?
I know it's not supposed to be relaxing, but it was very relaxing. I know biofeedback is not relaxation training; it's self-regulation. It was self-regulating. Yeah, I was more attuned to the noises in my environment. So just more aware, I would say. I feel calmer. Yeah, I know. Like as I was talking about my own sort of high blood pressure after birth and surgery, I could feel my body rising as I was talking about it, or my blood pressure rising, or my energy level rising. And then after doing this exercise, I feel calmer. Yeah. What do other people tend to experience when you do that?
Yes. So yeah, it was actually interesting because I was just teaching this practice the other day to a patient, and one of the things he said was he was surprised how quick it worked. How quickly he was able to make that shift. And what I think is, it's not something. These exercises are not things that you have to spend all day practicing. It can be done, in a matter of a minute, or longer. And, it's a very simple tool that I think yields very powerful results to really help, take the charge out of the stress reaction. And other, clients have said that they, feel more uplifted or more energetic or calm or relaxed. We're not, teaching, this is not relaxation training, but that doesn't mean that they don't necessarily, they won't feel relaxed. Or also a deeper kind of heart connection that comes up too. The heart is like the center of emotion, and people who focus on their heart area will sometimes say that they feel a deeper heart connection or deeper emotional connection with themselves or with other people.
Yeah, that I actually was experiencing that. I'm glad that you said that. And as I was doing this exercise, I was reminded of one day I was driving. I have to put a disclaimer at the beginning of this that we do this exercise so people don't do it while they're driving. Because I was driving and listening to an NPR segment. Maybe it was like a Invisibilia or some kind of cool NPR program. And they were playing sounds of heartbeats. And they gave a disclaimer at the beginning of the show and the disclaimer said, like, don't drive or be careful if you drive listening to these heartbeats. And I was like, oh, I'll be fine. I have such mind control. Da, 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 da. Right. And I was listening to these heartbeats, and I don't know what today is about me in pregnancy. I was pregnant at the time with my first child. And I was listening to these heartbeats driving. My husband was in the passenger seat and I was in the driver's seat. And I ran a red light. And I was like, so like moved by the heartbeat sounds that I was like in a, I don't know, I was in another world. And so I have to remember to put a disclaimer on this one, but how powerful. And when my kids now are 4 and 6, and what we do sometimes in my family is we'll listen to each other's heartbeats. And when I listen to my kids' heartbeats, I almost like want to cry because it's so, it feels so deeply moving. And I'm to your point about this deeper heart connection.
Like the first time you hear the heartbeat in utero, it's such a powerful moment. And I'm also thinking too about, so I have a 6-month-old and we use a sound machine at night. And one of the sounds is a heartbeat. Yeah. And that's the one we always go to because he was sleeping in our room up until he was, 3 or 4 months. And we would always put that heartbeat sound on. And it's so powerful. Absolutely.
Yeah. Yeah. Thank you for doing that exercise with us. I'm so curious if this will engender other, the listeners to think of or maybe I would encourage the listener to think of like what came up for them and their own deeper heart connection, or if they're not driving or please be cautious if you are driving, just, what their experience was of this. I'd be so curious to hear about that. Okay. So you've shared a bit about biofeedback and you've done this exercise with us, which was really enlightening. So how does biofeedback how is it used in conjunction with psychotherapy?
Yeah, great question. So in my experience, biofeedback has been a really powerful tool that I've been able to offer my patients. We're really living in this time where we crave immediate results and objective data, and biofeedback is a really powerful tool that can provide that. And some clients can be can be hard to engage them in traditional therapy, and biofeedback that's interesting and engaging and might be able to increase a client's willingness to participate in therapy. And biofeedback may be a more acceptable form of treatment for some clients, and I think can be a really great place to start for treatment. And when I worked in cardiac rehab, I would often get referrals for biofeedback training for patients with symptoms of anxiety and chronic high blood pressure. My patients would often say they wanted to get rid of their anxiety or have better control of their anxiety. A client that experienced a heart attack, they might experience anxiety about having another heart attack or overexerting themselves into having another heart attack. They might be too afraid to exercise and avoid activity altogether, and then lose their confidence in their ability to function in their careers or with their families, leading to more inactivity and more anxiety. And there would just be like so much anxiety present. And so, how do we stay within our bodies and in our experience when there is unpleasantness there, and everything is saying like, I don't want to be here in my own body. So I might ask a patient, when anxiety is showing up, what does that feel like in your body? Our body holds on to our stress and our trauma, and, just out of interest, like start checking in. What does it feel like in your body? Where are you resisting? And they may notice tension in their neck or their jaw, or tightness in their chest, or rapid breathing, or over breathing. Biofeedback can help clients recognize when they're engaging in things that activate their stress response, when they're not in that coherent state. And then we can use tools to shift back into coherence and, kick in that parasympathetic response. When there's discomfort, there's like this tensing against the discomfort and, thoughts about trying to get rid of the discomfort. This doesn't feel good, so I must be in danger. And so, with practice, the patients will start sensing like the different layers of resistance. Like they'll see the resistance, in real time through the biofeedback, and they'll see how it, flavors their experience, but it's not actually what's happening. So, okay, I'm not having another heart attack. This is my body feeling anxious. This is my body trying to energize me. And there's this very useful equation that we use in therapy. That's suffering equals pain times resistance, or suffering equals pain times worry. So suffering is caused by like resisting the pain. So what we resist persists. And with biofeedback, patients learn how to recognize and bring awareness to their physiological reactions, like the body's natural tendency to resist things that feel uncomfortable. And they might also recognize what's getting in the way. So things like, judgment and critical thoughts and ruminating thoughts, like attempts to control their situation. So, patients learn to disengage from unhelpful thinking patterns, like I'm never going to get better, to then create space for more skillful thinking and action. So instead of engaging in attempts to control the situation or going down that rabbit hole of self-defeating thoughts, like I can't do anything, I feel so useless, they can use more skillful actions like engaging in biofeedback breathing skills, like engaging in heart-focused breathing to restore that balance to the nervous system and then help them, connect to their goals and what really matters to them, like their intentions to take better care of themselves. So, I might not be able to do things exactly like I used to, but I can take small steps to engage in activities and follow the advice from my cardiac rehab team. So I really see it as a really nice complement to cognitive behavioral approaches or mindfulness-based therapy. What really happens to your physiology when you change your thinking or when you let go of negative thoughts. And so patients can get that real-time feedback, and it makes it easier to make those changes when you're getting that feedback.
Wow, you have just laid down, there are so many things that I want to follow up on here. One is that you talked about this can be a helpful starting place for psychotherapy, especially I'm thinking about the high levels of stigma for older adults to engage in mental health, high levels of stigma for men to engage in mental health, right? So if this is a sort of bridge and a tool that can help to reduce some of that stigma and create some measurable, action-oriented, improve health and well-being, right? And heart health. A lot of older adults actually, if they are receiving any mental health care, are receiving it in the context of medical care or primary care. And so I think this is a great bridge, especially for groups that are historically left out of mental health care, and especially if African-American folks are at a higher risk and with histories of mistrust, right? This also might be a helpful bridge because of the objectivity. I also was thinking back to these equations. So you said there's an equation that you use: suffering equals pain times resistance, or pain times worry. Can you break that down a little bit more for us? Like, give us an example.
Yeah. Okay. So in the equation, pain is the actual normal pain, like, chronic back pain or depression, like the normal pain of life. And resistance is the mental anguish caused by trying to resist that pain. So the equation helps us learn to distinguish between the normal pain of life, right, like the physical discomfort or difficult emotions, and then an actual suffering, the mental anguish caused by trying to fight against, basically caused by fighting against the fact that life is sometimes painful. So the chronic, so let's say pain, the actual pain is, chronic back pain, right? So you have chronic back pain that you're experiencing. And then the resistance is the worry thought about that pain. So the worry thought, like, I'm never going to be able to be the same again, or I can't, spend time with my grandchildren anymore. And all of those worry thoughts that are, around the pain, that's causing the pain to be more significant than it actually is.
Yeah, that's so helpful. And then it sounds like you're saying that the intervention point with that equation, the suffering equals pain times resistance, is in reshaping our relationship to that resistance and to that anguish. Like, I think you said what we resist persists. And so is that right? Am I understanding that right?
Yeah. So recognizing, where the resistance is showing up, and how it's like flavoring our experience, but it's actually different than, it's not the same as our actual experience. So the ways that, certain things are creating more suffering in your life than the act. Life is already tough enough, right? And so all the ways that, the resistance is creating more suffering in your life.
Yeah, powerful. So now, say that there are therapists or other health professionals who want to refer clients or loved ones to a program that's using biofeedback for cardiovascular health. How would they go about finding a program like yours, or what would their approach be? Like, I guess it's a two-part question. How would they discuss this with their patient? And then how would they help their patient find a biofeedback for cardiovascular health provider?
Yeah, great questions. So when talking about biofeedback with a patient with cardiovascular disease, I would first really want to validate, how difficult it can be living with heart disease. It can be really difficult living with heart disease. When you're living with a chronic heart condition, you may feel stressed or feelings of anger or sadness. Your sleep may be off, or you may have noticed more issues in your relationship. And when I start to talk about, all the ways that heart disease could potentially negatively affect a person, they're usually pretty on board and able to relate with their own experiences. And so then I'll, kind of segue into, when the body is stressed, that puts more tension on your body and, can increase your heart rate and your blood pressure, which is not healthy for the heart. And so learning, good stress management interventions can help your heart and, also help you learn ways to cope with the problems that may be associated with living with a chronic heart condition. And so with biofeedback, we can learn how your body reacts to different kinds of stressors and, figure out different ways to decrease your stress and learn tools to create, more balance within your nervous system and increase more positive emotions so that you can live more heart healthy. And usually folks, you were saying earlier, usually folks are pretty interested like in this type of modality. Like this is something new and it's interesting, and usually folks are usually pretty interested in trying biofeedback. And so if someone is interested or wanting to refer their patient for biofeedback, a really great place to start is bcia.org, which is the Biofeedback Certification International Alliance, which is it has a lot of great information about biofeedback. And you can also search for a certified biofeedback practitioner in your area. So that's a really great place to start. Also, if you work in the VA and your facility has a whole health program, ask if they offer HeartMath or any other types of biofeedback programs. A lot of VAs now are offering HeartMath and other forms of biofeedback in their facilities now. So that's a really exciting and great thing.
Well, those are great resources. So bcia.org, like Bravo, Charlie, Indigo, Alpha.org?
Yes.
Okay. And I'll link to that in the show notes. And then also some health medical centers like the VA healthcare system. Each VA healthcare system or VA hospital or medical center has their own sort of range of programs. So you can check in to see if your local VA offers whole health or biofeedback or alternative health programs. Is this considered alternative health?
Yeah. So yes, CAM, complementary and alternative medicine. Yeah.
Oh, great. Thanks. Complementary and alternative medicine. And so you can check with your medical center to see if they offer any programs like this. That's great. Well, Dr. Johnson, thank you so much for taking the time to share with us all of your knowledge about biofeedback and heart health and overall mental health. I hope this helps a lot of people in the community to get started, improving their heart health and living a great quality of life or optimal quality of life. Thank you.
Thank you so much for having me and for giving me this opportunity to talk about biofeedback. I love talking about this topic and ways to live heart healthy. And, biofeedback is such a powerful tool to use, and it's easy to use, it's safe, it's effective, it's evidence-based. It's used to improve quality of life for people of all walks of life, to help them find more balance and peace. And that's something that we all need right now. So thank you so much for having me.
Calling all mental health providers. Have you been feeling ineffective, stuck, or unsure of how to best help your client with memory loss? Well, it's not your fault. Most therapists haven't had any training in addressing memory loss or cognitive changes in therapy. But I got something for you. In my free 10-minute video where I walk you through 5 steps for helping your clients presenting with memory loss, you'll learn the difference between memory loss and mental health concerns for older adults and how to help. Get this free training and a bonus workbook that you can start using in your clinic today. Simply go to www.mentalhealthandaging.com/clarity to learn more. That's www.mentalhealthandaging.com/clarity, CLARITY.